John F. Kennedy, in reference to going to the moon, said that we don't do these things because they're easy, we do them because they are hard. And that's why we do the work that we do, because it's hard, but it's important and it needs to be done.
When our residents come here, they're obviously focused on how many stainless steel crowns can you do, all these types of basic pediatric dentistry restorative techniques. And when they leave here, I think they have a greater appreciation of kind of what is my role as a pediatric dentist besides just restorative care? What is my role as an advocate in my community for those who are underserved?
The Yakima, Washington site of the NYU Langone Advanced Education and Pediatric Dentistry Residency offers residents the opportunity to serve a wonderful community in the heart of Central Washington. Here at Yakima Valley Farmworkers Clinic, we offer a well-rounded education in pediatric dentistry with state-of-the-art facilities, an excellent resident-to-faculty ratio, and stellar support staff, all while providing a valuable service to the children of our community. Hi, I'm Jessica Webb, Associate Director for the Pediatric Dental Residency, and I'd like to share our program in Yakima with you. Yakima Valley Farmworkers Clinic prides itself on providing a level of care rarely seen in rural communities. While our patients are primarily Hispanic, Spanish-speaking families working in the agricultural industry, our residents have the opportunity to care for all children in the Yakima Valley and receive robust training in caring for children with special healthcare needs.
It's a very busy residency. You're going to see lots of patients here, but we prepare you for that. We start you off with the background in the literature. We start you off slowly with patients, and over time we build you up so you feel comfortable and confident in treating patients in that tempo, and you have the knowledge to do so.
Our goal is to prepare our residents to be able to thrive in any practice setting they choose upon graduation, and to be committed to serving the children who need their expert care the most.
When we're talking about patients, it's easy just to focus on what you're doing, what your specialty is. And so with dentistry, that's a tooth, right? And so I always tell the dentists or our residents, listen, that tooth is attached to a kid, that's attached to a family, that's attached to a community. And so we're not just fixing that tooth, we're fixing way more than that.
We have 2 pediatric dental clinics in Yakima where our residents train. Viewcrest Pediatric Dental Clinic at Lincoln Avenue Medical Dental and Children's Village, both of which have modern facilities. Our program admits 3 residents per year, and our 6 residents work alongside 4 attending dentists and a team of dental assistants and expanded function dental hygienists.
The amount of access we have to attendings is hard to beat. I feel like when I leave here, there's going to be so much that's been poured into me by this close-knit group of attendings. I don't really see any area of this field that I'll be lacking in knowledge or the tools to find more knowledge.
Our residents receive didactic and clinical training in all aspects of pediatric dentistry, including prevention, restorative, pharmacological behavior guidance, non-pharmacological behavior guidance, growth and development, pulp therapy, trauma, and the care of patients with special needs. Didactic training includes remote learning with NYU Langone, as well as local classes taught by faculty and a weekly literature review.
Reading things and kind of discussing things can only take you so far, and I feel like that final kind of cementation of concepts really happens when you're sitting with the patient, and I think that's one big strength of the program is you get to be chairside with patients a lot.
Well, this residency is great because of the people that are here. We have the best attendings around, and our team works really well together between all the staff that make up farm workers and also the residents that work together. Everyone works as a well-oiled machine. We're all very supportive of each other. We make coming to work fun, and at the end of the day, that ultimately benefits our patients.
I think that's definitely one of the biggest strengths of the program, not only just the ratio itself, but the fact that the faculty are here full-time. This is the only job that they have. They don't work at outside practices. So you just form really close relationships with them, and I think developing that comfort level really facilitates learning.
Resident rotations include anesthesia, emergency medicine, outpatient pediatrics, genetics, cardiology, inpatient pediatrics, cleft lip and palate team, and autism spectrum disorder diagnostic clinic. Our program and its faculty are very mission-driven, so woven throughout our residents' time with us is training in ethics, oral health disparities, advocacy, barriers to accessing care, and leadership.
You know, we always worry about, okay, that patient's 5 minutes late, it's gonna ruin my schedule. Well, 5 minutes late, we don't know what that patient went through or that family went through to get here. You know, they could have taken 2 or 3 buses to get here, or mom just got off of work in the fields, had to pack up the kids, and then bring them here.
One of the experiences that I found kind of most enlightening as a resident is you get to do lots of rotations through the different departments, primarily here at Children's Village.
From mental health, emotional health, dietary health, which so often affects the dental world, but we have access to all of that. And the fact that I have access to it means that my patients have access to it.
Maybe the best kept secret of our program is the community that surrounds it. Yakima offers a great mix of the sights and activities of a city with the charm of a small town. We have farmers markets, festivals, wineries, breweries, live music, golf, hiking, and winter sports.
A lot of our attendings and faculty are either born and raised here or have found a special home here and have been here a while. And so they're not looking for the next place to go. This is the place to go.
We experience 4 seasons with over 300 days of sunshine a year. By being centrally located in Washington State, we are not far from anywhere in the Pacific Northwest, including the cities of Seattle, Portland, and Spokane, and the many outdoor attractions the area has to offer, which are some of the most beautiful places in the country.
The residency program does a great job of fostering a positive learning environment. You get really good volume of patient experiences. As I progressed more and more, particularly as I became more clinical, I just found that the more you do, the more you really learn it.
The Yakima, Washington site of the NYU Langone Advanced Education and Pediatric Dental Residency is a strong and well-rounded program where residents get to experience collegial relationships with their co-residents and attendings, get to have the privilege of providing excellent care to the children who need it, get to enjoy the robust support of the Yakima Valley Farm Workers Clinic, its facilities, and its staff, and get to do so in one of the most beautiful and charming areas in the nation.